Okay. Great. So our program today will run for about 30 minutes, and it will include powerful words from 5 women, including Rosa Lopez and Angela Osorio, who have directly suffered and continue to suffer the consequences of failed mental health care in detention. We'll also hear from physician Dr. Altaf Saadi and DHS whistleblower Ellen Gallagher, each with decades of experience and expertise. I do want to warn at the outset of our program that this will be emotionally salient and include upsetting examples. For any of us who have experienced ourselves or through those near to us mental illness or mental health challenges, including death by suicide, today's content may be particularly triggering. So thank you nevertheless for being here. Some quick logistics for those who are just joining. Again, I'm asking that you please stay off video and on mute to respect and spotlight our speakers. At the end, I will share 2 items for congressional staffers who are joining, a Dear Colleague circulating on this key issue, as well as the Dignity for Detained Immigrants Act. We will also have a Q&A section, and questions can be directed to me throughout our presentation by chat, and we'll do our best to answer those. So for the next 30 minutes, what we would ask is that you stay present with us and not multitask out of respect, especially to Angela and Rosa, who are joining us here today. Today's briefing is timely. Just last month, Kelsey Vial, a young man from Brazil, died from suicide while in indefinite ICE custody at the privately operated Torrance County Detention Facility in New Mexico. Just last week here at NIJC, we secured the release of a client in ICE custody who'd been detained in Kentucky, where in response to his symptoms associated with his serious psychotic disorder, officers pepper sprayed him, leaving him to wash his face with toilet water in his solitary confinement unit, then shot him with a pepper ball gun and placed him in restraints by arms and legs to a chair, finally leaving him naked without a sleeping pad in solitary confinement. On a personal note, I spoke just this week to my first client as an immigration defense attorney. At 19 years old, after an entire life in the US, he lost his DACA status due to his first contact with the criminal legal system. And after a day in criminal jail, found himself stuck in what would be 2 years of immigration detention before we could get him out. I can still remember the night he called me at 1 a.m., out of breath, palms sweating, heart racing amidst an anxiety attack, to tell me he was questioning his life and how to take it. I asked if he had requested immediate care, and he said he had been doing so for a week without response, and that this was the first time an officer had offered help, which was permission to use a phone to call his lawyer. These stories are not exceptions or outliers. NIJC has for years now, alongside many of our partners, recommended that the government phase out the use of immigration detention entirely, because these pervasive problems are irreparable and inappropriate for civil administrative proceedings. But the impetus for today's briefing is a civil rights complaint that we filed this summer with DHS's Office of Civil Rights and Civil Liberties, CRCL, which documents the pervasive nature of failed care and abuse of those with mental health illness and challenges. And so with that, I will turn it to Nubia Fimbres on our NIJC team, who is the primary author of this complaint, to share our findings briefly and lead us through our program. Thanks so much.
Thank you, Naina, and hi everyone, good afternoon. My name is Nubia Fimbres and I work with the policy team at the National Immigrant Justice Center. I want to start by acknowledging just how often we at NIJC, and I'm sure others in this call, have heard a client in detention say, "I'm going crazy in here," or "I can't take it anymore, I'm losing my mind." And I'm sure it weighs heavily because we feel just so completely helpless in those situations. And so in speaking with people for the civil rights complaint we filed, and especially speaking with Angela, one of our panelists today, I was reminded that detention itself is disabling. Whether or not someone enters detention already experiencing mental illness and disability, the chances that they will leave with lasting mental health challenges are high. So it'll be most important to hear today from Rosa and Angela. But before we turn to them, I'd just like to quickly summarize the key findings from the complaint that we filed this summer. We filed it on behalf of 3 previously detained individuals, and it includes expert affidavits from 3 physicians, including Dr. Altaf Saadi here today. So our complaint highlights 4 main trends. The first being that people in detention experience significant delays in mental health care, and often their requests for mental health care go completely unanswered. So getting a mental health appointment takes weeks, if not months. And meanwhile, their symptoms get worse and worse, and their mental health declines. The second trend is that if and when a detained person finally sees a mental health provider, the treatment is usually poor and neglectful. All 3 of the complainants that I spoke with expressed that they didn't feel like their health was a priority to the doctors they were seeing. They didn't get explanations for the medications they were being prescribed. There was no follow-up appointment. They were viewed as liars and viewed with disdain. So experts reported that medical providers often Google their mental health disorders to make these decisions on treatment, and they'll offer over-the-counter painkillers for symptoms associated with psychotic and other serious mental health illnesses. And third, ICE detention includes the widespread use of solitary confinement, often referred to as segregation or the hole. Solitary confinement is used frequently and often is responsible and often in response to symptoms of mental illness. So it's utilized as an immediate punishment for minor infractions a lot of the time. And this occurs despite the decades of research that shows that solitary confinement results in adverse psychological effects, and it increases self-harm for any individual. And it increases the likelihood too of death by suicide, especially for those with pre-existing mental health conditions and illnesses. And then finally, our complaint offers a very long list of ICE's own detention standards that were violated by this failed mental health care system. So the findings described in our complaint are pervasive across immigration detention facilities nationwide. And for this reason, we are requesting a system-wide investigation along with critical policy changes by ICE, including a presumption of release for anyone with mental health illness or disability. These asks are included in the Dear Colleague letter that's co-sponsored by Representatives Castro and Raskin, and that is circulating in the House right now, so we urge you to sign on. The findings in our complaint, they also underscore that the immigration detention system is wholly incapable of responding to the mental health needs of people detained, both of those who walk into detention with prior mental health illness, like Rosa's son Victor, and for those like Angela who develop these symptoms once inside. So to put it shortly, the use of detention to enforce civil immigration laws inflicts profound mental suffering on those inside and their families outside. And so to put these findings into context, I'd like now to turn to Rosa Lopez, our first panel speaker. Rosa is here today to talk about her son, Victor, who died by suicide in May this year, 5 months ago. 5 months after being released from ICE detention, where he spent 6 years, including long stints in solitary confinement. Rosa will read her statement in Spanish, so please follow along on the screen in English. Thank you. Adelante, Rosa.
¿Me escucha? ¿Me escucha?
Sí, Rosa, adelante.
Sí. Mi nombre es Rosa López, soy de México, pero emigré a los Estados Unidos hace más de 30 años. Soy la madre de 4 hijos, incluyendo a Víctor Sánchez. Estoy aquí para compartir la historia de mi hijo Víctor, quien estuvo detenido con inmigración por casi 6 años, a pesar de ser ciudadano americano. Durante esos 7 años de detención, él sufrió mucho y poco a poco se fue deteriorando. Salió de detención en diciembre del 2021, pero para ese momento ya no era el mismo de antes. batalló mucho con su salud mental. Últimamente sus miedos, paranoia y trauma fueron demasiado para él. Acabó con su vida 5 meses después de salir de detención. Desde pequeño, Víctor era muy imperativo y se metía en muchos problemas. Cuando tenía 11 años, descubrieron que se comportaba de esa manera porque tenía esquizofrenia, trastorno bipolar. Comenzó a tomar medicamentos, pero luchó por mantenerse estable. Como resultado, se involucró en el sistema legal, penal y fue a la cárcel. Antes de ser enviado a detención de migración, su salud mental se había estabilizado y sus doctores finalmente habían encontrado medicamento que le estaba funcionando. Después de estar en la cárcel, lo trasladaron a custodia de ICE. Presentamos evidencia para demostrar que él era ciudadano estadounidense, pero ICE continuó deteniéndolo debido a una confusión sobre su acta de nacimiento. Más de 6 años después, una corte federal confirmó que Víctor era ciudadano estadounidense. Dentro de detención, la salud mental de Víctor se deterioró rápidamente, en parte porque el centro negó a darle el medicamento que lo había mantenido estable. Durante casi 6 años detenido, estuvo en varias cárceles. No tengo idea por qué lo trasladaban tanto, si él estaba enfermo. Pero de repente me hablaba y me decía que estaba en San Diego o en Arizona. Creo que eso es parte de la razón por la cual mi hijo perdió el sentido de la realidad. Iba de cárcel en cárcel, sabrá Dios por qué. Los últimos 2 años estuvo detenido, fueron los más duros. Estuvo casi totalmente en el confinamiento solitario. Durante este tiempo, cuando estaba en confinamiento, Víctor sentía que se volvía loco. A veces me hablaba y ni siquiera recordaba su nombre. Imagínense, estaba en el cuarto sin poder caminar, sin poder salir afuera, solo lo sacaban para bañarse, como no se iba a volver loco. Recuerdo un día que él me habló del centro de la cárcel de Carolina del Norte. Le pregunté, Víctor, ¿qué estás haciendo ahí? Me dijo, no aguantaba más y traté de suicidarme. Y lo tenían bajo observación. Nunca me explicaron por qué lo trasladaban tan lejos. Víctor intentó quitarse la vida 2 veces cuando estaba en confinamiento solitario. Él no entendía por qué estaba detenido. Vivía constantemente con mucho miedo. Él decía, yo estoy muy cansado, mamá. Ya no quiero vivir así. Esto era muy doloroso para mí. Siempre era doloroso hablar con él porque sabía que estaba sufriendo, que se estaba deteriorando, perdiendo en el mundo de alucinaciones y voces. Yo también sentía que estaba en la cárcel aquí en mi casa sin poder estar con él y ayudarlo. No entiendo por qué lo maltrataron tanto, lo mantuvieron tanto detenido, porque lo tenían solitario. Víctor estaba enfermo, tenía una enfermedad mental. Cuando una persona está enferma, se debe de ayudar, pero en lugar de ayudar a Víctor o liberarlo para que recibiera atención médica adecuada, lo aislaron. Fue un momento muy, muy feliz cuando un juez ordenó su liberación de Víctor. Pero Víctor nunca logró sanar. Continuó batallando con su salud mental después de su liberación. De alguna manera se había acostumbrado a estar completamente solo. Estaba aterrorizado de que migración lo enviara de regreso a la cárcel. A veces me llamaba paranoico que estaba tratando de que estaban tratando de atraparlo. Yo le decía que ya estaba bien. Hice todo lo posible para conseguirle ayuda, pero fue difícil. El centro de detención le dio medicamento por pocos días después de su salida. Al final de todo fue demasiado para Víctor y se quitó la vida en mayo. Tenía 32 años, dejó atrás un hijo de 10 años. Víctor no pudo recuperarse cuando salió por el daño que sufrió por estar detenido tanto tiempo, por no recibir tratamiento que necesitaba, por estar completamente solo. Yo sigo muy triste y enojada con todo lo que pasó con mi hijo. Por eso estoy aquí hablando con ustedes. No quiero que lo que pasó con Víctor le pase a otras personas. Gracias por su tiempo.
Gracias, Rosa, por compartir esta declaración con nosotros. Yo he escuchado su historia varias veces y todavía es difícil escucharla. ¿Sí nos puede decir sobre la foto que está atrás de usted?
Sí, él es mi hijo, Víctor. ¿Y me puedes traducir para decir algo?
This is my son, Victor, behind me. I'm sorry, everyone. I'm translating for Rosa.
Les doy las gracias a todas las personas por su tiempo que están aquí.
I give thanks to everyone who is here.
Y les suplico a las personas presentes que si hay algo que puedan hacer,
And I ask that the people present, that if there's anything that could be done,
por favor, ayúdenos en nombre de mi hijo, se los pido.
please help us in the name of my son, I ask you.
Que ya no haya más víctimas
That there are no more victims
y las personas con enfermedad mental
and people with a mental illness
son personas presas de su enfermedad
are people that are in jail because of their own illness
y presas de un sistema,
and part of a system,
y esto es inhumano.
and this is inhumane.
Y
Gracias.
por favor les pido que escuchen lo que estamos hablando.
And I please ask you to listen to what we are saying.
Y este es mi hijo Víctor.
And that's a picture of Victor behind her. Thank you so much, Rosa.
Gracias, Nubia.
Our next speaker is Dr. Altaf Saadi. Dr. Saadi is a general neurologist and hospital neurologist at Massachusetts General Hospital and an assistant professor of neurology at Harvard Medical School. She has extensive experience working with detained individuals in facilities across the country. And she's here today to provide her perspective as a clinician on the abusive practices she's witnessed as it relates to mental health and medical care.
So thank you for the opportunity to bring a medical perspective regarding the mental health care and abusive practices in ICE detention. My name is Dr. Altaf Saadi, and I'm an assistant professor of neurology at Harvard Medical School, practicing neurologist at Massachusetts General Hospital, associate director of the MGH Asylum Clinic, and a member of the Physicians for Human Rights Asylum Network. As a physician and researcher who has conducted dozens of evaluations of individuals in ICE detention and on conditions of confinement in ICE detention, I have an intimate knowledge of how healthcare is provided and impacted in immigration prisons. I want to begin with a story of someone I spoke with in 2018 at the Adelanto detention facility in California that has stuck with me since. Multiple men in one dormitory had filed grievance reports against a cruel detention officer. In retaliation, another officer took them outdoors at dawn in their underwear and thin t-shirts and made them stand in the cold for an hour. "This is to teach you a lesson," he told them. "What about our human rights?" shivered one man. "In this country, you only have human rights if you have money," answered the officer. I begin with the story because I feel it encapsulates 4 main points I want to highlight today. First, it's important to humanize the statistics about those in immigration prisons. Statistics are comprised of individuals, as we heard earlier in Rosa's story, each with family and friends, hopes and dreams. Second, the story is reflective of the adversarial relationship between people detained and detention center staff, some who are first to respond to health crises and even responsible for developing and managing health services. This results in a punitive approach to mental health care rather than a therapeutic one. A man I interviewed with schizophrenia recalled banging his body against a wall as he wrestled with voices telling him to kill himself. A guard told him to, quote, get over it, and referred to his distress as a, quote, tantrum. Other detainees told me that staff used racial epithets or referred to them as crazies or trash. In one study of 493 detained individuals in California, we found that 42% experienced verbal and physical abuse by guards, and nearly half reported witnessing verbal and physical abuse by guards. Both experiencing and witnessing abuse was associated with worsening mental and overall health. Additionally, among detention staff, there's widespread assumption that medical concerns of detained individuals are not legitimate, and they are exaggerating symptoms. There is a lack of basic respect for those seeking treatment, which runs contrary to how a therapeutic relationship with any individual should be developed. Third, retaliation is a theme that comes up repeatedly in my interactions with immigrants in detention. Retaliation occurs in response to a host of actions, including basic requests like requesting medications or food. Individuals can be denied outdoor time, transferred to facilities further away from their families, or even thrown into solitary confinement. Individuals are particularly afraid to disclose suicidal thoughts for fear of being thrown into solitary, which worsens mental health. One individual at the Adelanto Detention Center told me, I can't ask for help because they will put me on suicide watch by myself and I get more depressed. It doesn't help. I don't trust them, so I suffer in silence. Finally, the story I began with occurred in a for-profit detention facility. Profit motives of immigration detention centers negatively impact medical decision-making. I met and reviewed the medical records of a man with schizophrenia who had been thriving and holding steady employment in his community for years while on his medications. But in detention, ICE abruptly stopped his medications and after nearly 2 weeks, started and gave him an alternative and less effective medication. He was told he was prescribed this other medication because it was less expensive. As a result, he experienced worsening hallucinations, suicidal thoughts, and attempted suicide 4 times while detained. As a physician, I'm disturbed by the subpar and neglectful medical care detained individuals receive in the immigration detention system. In a system that's designed to punish and often designed to do so while also driving profit margins, it's hard to envision how good medical care can even be provided. I'm concerned that without accountability for the neglect and abuse experienced by individuals in ICE custody, there will continue to be deaths and exacerbated serious mental health problems for those in detention. Thank you for your time.
Thank you so much, Dr. Saadi. I think that last part that you described is incredibly important and really gets to the heart of the issue, which is that our immigration system is designed to punish, and therefore it's ill-equipped to deliver good medical care and good mental health care. Our next speaker is a DHS whistleblower, Ellen Gallagher. In 2019, Ellen offered an in-depth look at ICE's use of solitary confinement on mentally ill and medically vulnerable adults across more than 200 immigration detention facilities. 3 years ago, she publicly exposed ICE's abusive practices, and she's here to tell us what, if anything, has changed. Thank you.
Thank you so much for the opportunity to speak today. I'm an attorney and a senior advisor in the DHS Office of the Inspector General, but am providing this information as a whistleblower who reported the misuse of administrative and disciplinary segregation in immigration detention facilities from February of 2014 to May of 2019, when I went on the record with the International Consortium of Investigative Journalists, The Intercept, and NBC News. Since then, I have been represented by the Government Accountability Project. I have worked for the federal government since March of 1995. Again, I am speaking today in my personal capacity and not on behalf of my employer, the DHS OIG. Over the course of my whistleblowing, I filed complaints with the DHS Secretary, U.S. Office of Special Counsel, DHS OIG, and House and Senate oversight committees. My complaints included dozens of weekly segregation reports, as well as detailed medical and facility records. In studying the reports, I was shocked that individuals in civil detention, which is inherently non-punitive, could be sentenced to solitary confinement. Over and over again, I found information confirming that seriously mentally ill and other medically vulnerable detainees were being placed into solitary confinement for reasons directly related to or caused by their illness. They were deprived proper medical care even when suicidal, and missed immigration court dates that otherwise might have enabled them to seek bond or legal protection. Some segregation reports featured detainees placed on suicide watch, in complete isolation, while stripped bare and forced to wear a suicide smock. Not surprisingly, some detainees feared disclosing suicidal ideation lest they be treated in this manner. Subjecting seriously mentally ill and medically vulnerable detainees to solitary confinement clearly violates ICE detention standards and ICE's segregation directive, not to mention disability law and due process. Both the standards and the directive state that segregation should be used as a last resort, yet segregation typically serves as the default remedy for anyone deemed unfit for the general population. Approximately 1/3 of all placements in segregation involve individuals suffering from some form of mental illness, the vast majority of whom were unrepresented. Typical sentences were between 15 to 30 days, although some were far longer. The DHS OIG never directly addressed the reams of data I provided evidencing systemic and individual violations. Instead, the OIG conducted unannounced inspections, usually 4 per year, that consistently found violations related to segregation, but limited recommendations for change to those specific detention facilities. Finally, in 2021, the DHS OIG released a report based on an audit of whether ICE's use of administrative and disciplinary segregation across all detention facilities complies with ICE detention standards. This is a notable example of progress, and the OIG deserves credit for moving in this direction. The OIG found that from 2015 through 2019, ICE failed to consider alternatives to segregation for 72% of all placements, or to record 13% of all segregation placements as required. Essentially, the OIG found widespread violations related to data collection, retention, and reporting requirements. Missing from the 2021 OIG report is any meaningful discussion of the physical and psychological harm resulting from ICE's use of segregation. The nature and extent of this ongoing harm form the basis of my whistleblowing, yet it remains largely unaddressed. One of the more egregious cases featured in my whistleblowing involved a male detainee diagnosed with schizoaffective disorder with hallucinations and suicidal ideation, who spent months in and out of solitary confinement before being sentenced to 390 more days for throwing his feces at a security guard. He was at least 4 times descheduled from appearing before an immigration judge because he kept being placed into isolation. At times, his condition worsened so badly that he was moved to a psychiatric hospital for treatment, then placed back to serve out the remainder of his term in solitary confinement. Despite my repeated efforts to elevate concern about his treatment and the prospect of his death, DHS and other officials refused to intervene. I appreciate your time and am available to answer any questions that you might have. Thank you.
Thank you so much, Ellen. Our last speaker is NIJC client Angela Osorio. Angela Osorio is an advocate in her own right, and she will be sharing not only what it was like for her to be in detention, but how it continues to affect her today. Angela did not experience mental health illness before she was detained, but being in detention changed that. Go ahead, Angela.
Good afternoon. My name is Angela Osorio. I was born in Colombia. but came to United States in 2000 when I was 19. I have 3 wonderful children who are US citizens. I am very close to them. They are my entire world. In 2021, ICE arrested me at work after I had already completed probation for a non-violent conviction a few years before. I was detained at McHenry County Jail in Illinois. When I was in detention, my whole life changed. It was the first time I was separated from my children, and this is what hurt me the most. It killed me that they were struggling to cope with the situation, and I was in detention helpless. Before detention, I had never had any significant mental health problems, but at McHenry, I became depressed. It was just way too much for me to handle. The conditions were terrible. The way the staff treated us was horrible. It was like we were not even humans. I would cry a lot. I'd sleep all day. I always had sweaty hands and chest pains. I tried to commit suicide at McHenry by cutting my wrists. I was fighting with a voice inside my head that said it would be better for my children if I were gone, because at least they wouldn't have to worry about me being behind bars. One of the other girls helped me by putting pads on my wrist. I never told the guards or the doctor. I knew they would send me to the hall, which would make me feel worse. I finally asked to talk to a mental health provider for help, but it took 3 weeks to get an appointment. The specialist only saw me for like 2 minutes. I was literally crying, telling her how I felt, and she didn't even make eye contact with me. It felt like she didn't care about my well-being. When McHenry closed, I was transferred to Chase County Jail in Kansas. Chase didn't have a mental health person, so I had to wait 2 months to talk to someone, and the meeting was on Zoom. So it felt impersonal. There was also an officer right next to me during the meeting, so I couldn't really express myself. The conditions at Chase were horrible. We weren't allowed to go outside. There are no windows, so I could never tell if it was day or night. The staff also mistreated us. I remember once I had a terrible migraine to the point where I was throwing up. After hours of not doing anything, they gave me Pepto-Bismol, which didn't help because my nausea was due to my migraine. Things like this made me realize they didn't care. ICE released me from detention about 10 months later, and my depression came with me. I continue to take medication for my depression, but sometimes I feel like nothing will help. It's hard to explain, but sometimes I feel like I never really left because my mental health isn't like before. When I'm working, I find it difficult to focus. Sometimes I just start crying out of nowhere. My children are the only thing that gives me the strength to keep going. I don't want anybody to go through what I went through. It's not fair. It's not fair for my son still going to therapy. I prefer not to talk about my detention. I want this chapter to end. But people need to know what happens. I want you to know my story so that things change for the people that still inside suffering. Thank you for your time.
Thank you so much, Angela, for speaking with us and for being here today. We are so grateful to you as well as to Rosa for reliving what is a painful time in your life in efforts to support the work that needs to be done to make sure this doesn't happen to others. And so just want to offer my gratitude to you on behalf of all of us who are on the line today. This is, the end of our formal briefing. If folks have questions, you can start, feel free to chat them in. But, I think our hope at NIJC is that you walk away today grounded in and closer to the humanity implicated in ICE's repeated system-wide failure to provide adequate mental health treatment and care, but also educated by looking at our complaint and listening to both of our experts today on the specific ways in which ICE and the county jails and private prisons it contracts with fail to provide necessary mental health care and treatment, and the ways in which detention exacerbates existing mental illness or leads to lifelong mental health challenges. And we hope that you will be committed, particularly those of you who are here today from congressional offices, to working with us at NIJC alongside our partners as we push DHS to take bigger steps for overdue remedies. And so to that end, I did want to mention for any staffers who are here on the line, to please urge your bosses to sign the Dear Colleague that is circulating on the House side from Representatives Castro and Raskin that lifts up our complaints, findings, and asks. The deadline for that sign-on is September 30th, and we will send follow-up. For staffers who are here from both chambers, we urge you to sign on to the Dignity for Detained Immigrants Act, sponsored by Senator Booker in the Senate and by Representative Jayapal in the House. Dignity ends the use of solitary confinement, as well as takes many other measures to decrease the reliance on detention in our civil immigration system. And so with that, I know that you all can't see questions, but if you have questions, they come directly to me and I will share them out here. And we're happy to answer any that you have. And if we can't answer them now, we're happy to follow up, offline to answer questions for folks. Since we have a little bit of time left, there were some questions that were submitted. I think we can start with one. And if you just give me one moment, I'm going to make sure our speakers can be on video here. Okay, our speakers should be able to join us now by video. I think the first important question that was asked was, and maybe we can start with you, Ellen, and then Dr. Saadi, if you want to weigh in after Nubia can finish out, is whether there are any detention facilities in the ICE detention system that do provide adequate mental health care and treatment to folks who are in detention. Ellen, I'll toss it to you.
Thank you. During the time that I was reviewing detention settings and cases involving individuals suffering with mental illness, I was unaware of what might be called a truly therapeutic setting. Some facilities did have medical providers on site or available through the broader community. Other settings would transport ill detainees to hospitals or other intense service centers for emergency or periodic care. ICE has a cadre of medical professionals, the Health Services Corporation, that provides direct care to detainees housed in approximately 20 designated facilities throughout the nation. However, this in no way reaches the full population of detainees, and the Corps itself has historically been marked by high vacancy rates. And I think that is a trend across so many of the immigration facilities, high vacancy rates of key clinicians and direct service providers. And so, no, the answer is I did not encounter any immigration detention facility that was equipped to address the needs of individuals suffering from mental illness.
I will chime in to say that I agree with Ellen. At the root of this is the reality that the way the detention system is set up it's a punitive approach to providing care to the people in detention. There at the outset, there is lack of respect for these individuals, disbelief when people share symptoms that they're experiencing. So I think from sort of the beginning throughout, there is a punitive approach to care, and that's not how we build or develop therapeutic relationships. So I would also answer that no, because just the way the system is inherently set up, it doesn't lend itself to providing adequate care.
Yeah, The complainants that I spoke with for the civil rights and civil liberties complaint, they were from different parts of the country. They were from 4 different detention facilities in the Midwest alone. You heard earlier, Rosa's son Victor, he was detained in several facilities in California. He was in Arizona. He called her at one point from North Carolina. I also mentioned several facilities in our complaints from across the country with all of these documented abuses and neglect relating to mental health care. So all of these facilities in one way or another failed to provide that treatment and care to the people it was detaining. But I think that beyond mental health care, let's say that there were improvements to the treatment and care on that front alone. Why do people become depressed in detention? It's because they're miles away from their families and they hardly speak to them. It's because they're fleeing from violence in their home countries and they're carrying that trauma with them when they come to the US. It's because, they're being transferred from one facility to another without any notice to them or their families. The conditions are awful, the food is bad. There's little outside time. They receive dirty clothes. The showers don't work. The toilets don't work. The guards often mistreat them or are outright racist or sexist. So, it's a lot of things that are contributing to this issue. So even if this part of mental health care, if that was addressed, it's not like things are going to get better. Yes, that needs to be addressed. But it's also a systemic issue as a whole. It's a kind of setup that it just kind of completely demoralizes the person that's in detention. And that's why so many people in detention develop some kind of mental health challenge. So, that's a long answer, but in other words, no, I don't believe that there are any facilities really that are equipped to provide mental health care.
Thank you all. One more question, and maybe this, starts, I think, is more directed toward you, Ellen, but, I think folks are eager to hear any thoughts you might have on what members of Congress and advocates can do to, even more effectively fight and advocate for, very overdue attention to this and change on this from your perspective as someone who's still, working within the department, what things might there be to do differently?
Thank you again for the question. Well, I certainly would support your suggestion that individuals back some of the legislation that's been proposed. In 2019, there was legislation proposed to severely limit the use of solitary confinement in immigration detention. In the Dignity for Detained Immigrants Act, as you said, there's a prohibition against use of solitary confinement. I think that that kind of legislation would have a dramatic impact on preventing the harm that we're discussing today. I found in my own whistleblowing journey that educating myself was critical. I didn't believe what I was seeing. I was so surprised by the fact that a lot of people just didn't know that we use solitary confinement for a civil population. It's somewhat, just remarkable, and yet it's ongoing. And many times people don't realize this is happening. So I urge everyone to educate themselves, read the many reports that have come out, study the medical findings, understand just what's involved in putting an individual into isolation like this for weeks and months on end, and just how detrimental that is to their overall well-being. And by corollary, educate other people, that you are around, pass on that knowledge. One of the things that struck me was how individuals were suffering in detention and had no representation. And so I explored organizations like solitarywatch.com. I looked into what the work of the Southern Poverty Law Center, NIJC, so many organizations and even academic settings where there was outreach into the detention facilities to try to link people with representatives or lawyers so that they could understand the situation they were in. And especially when it came to disciplinary hearings, be represented in those hearings rather than just given a slip of paper saying you're now going to be in solitary confinement for 45 days because we found one anti-anxiety pill in the book that you were reading. Happened in one of the cases, absolutely unrepresented, no recourse. So just whatever you can do to support outreach into the detention settings and representation of the individuals that are subject to these practices is very important. Those are some of the suggestions I would offer.
Thanks so much, Ellen. I'm going back on video here. And I wanted to just, before we wrap here, first share, just to say, because I'm the only one who can see the chat, how much gratitude folks are sharing by chat to you, Angela, and also to Rosa. We will, of course, make sure to convey that to her. For you both especially being here to share your stories. So I did want to just say that in front of everyone, since not everyone can see those chats coming in. And I also, just because we have a few minutes, I wanted to share that yesterday when Nubia and I spoke with Angela to prepare for today, we caught her in her car, which was packed full of things like diapers and all kinds of other supplies that she has been collecting in her community for folks who are being bussed in from the border to near where she lives so that she can support them at the shelters that they're at. And when we mentioned, talked about that with her, she shared with us a story of something she overheard that really resonated with her in light of her own experience. And so Angela, if you're willing to share that very quickly, briefly before we end, we would be grateful for that.
Thank you, Naina. Yes, so I trying to help as much as I can to the community, especially immigrants. So the ones that are, bused to Illinois, most of them are families. So I was with this family. We went over the weekend to buy some meat at one of the meat processor company that it's open to public on weekends. We were walking through a hall, which I never happened to think about it, but the kid, he was behind with his dad, mom and dad, 6-year-old. And he says, Dad, this looks like immigration jail. It broke my heart, just knowing that a 6-year-old know what a jail looks like. So it's something that immigration needs to change. Immigrants shouldn't go to jail. It's not fair, especially, my kids, they were really worried about me because everything they see in movies and news that happen in jails. So immigration shouldn't have a different system to I don't know. I don't know what to do. I don't know. I'm not into politics, so I don't know how it can change. But just keep in mind that a 6-year-old will have this memory for forever. He will never forget, and he knows already what the jail looks like. And then I just look around and I was like, wow, it does look like a jail. So it broke my heart. It broke my heart.
Yeah, and ours too. And so thank you so much for sharing that here with everyone, not just with Nubia and I. So much gratitude. And as I said to Angela yesterday, her hearing that was a sign from somewhere of how necessary it was for her to be here today, and that all that she's doing as an advocate in her own right, and that Rosa is doing as an advocate in her own right, we hope will benefit young people like this 6-year-old that you just described. So thank you again. Thank you to all of you who joined. There are many messages that we've received. For any that we were unable to respond to, we promise to follow up after this. We will take a look at any questions we missed. There are a lot of email addresses. Looking forward to working with many of you. This has been recorded. We will post this as soon as we can and share that link out. We had a great attendance today, but really urge you to share this with as many folks as possible. and, you know, look at our complaint and look forward to working with all of you going forward. Thank you so much again to Ellen, Dr. Saadi, Angela, Rosa, and Nubia. Thanks so much, everyone. Take care.